Hi, I'm Kayla. I'm a student nurse at RCSJ, and I will be explaining asthma to a parent and my 6-year-old patient. So the first thing I would want to share with them is what asthma is. So I would share that asthma is a chronic inflammatory disease of the airways that causes airway hyperresponsiveness, mucosal edema, and mucus production. Inflammation ultimately leads to recurrent episodes of asthma symptoms, and patients with asthma, my patient, may experience symptom-free periods of acute periods alternating with acute exacerbations that could lead from minutes to hours and sometimes even days. And I'll also let them know that the most common chronic disease of childhood is asthma, and it can begin at any age, so I'll reassure them at 6 years old it's not uncommon. And then the next thing I would want to share with them are some causes. So causes could even be allergy, which is the strongest predisposing factor for asthma, chronic exposure to airway irritants, so the pollen outside, things that fall from the tree, grass, seasonal allergies. Too much exercise can also be a trigger for asthma. Stress or emotional upset, if anything's going on that's very stressful within their family, this can trigger constriction of the airway leading to asthma as well. Any medications that they're on, so I would always want to assess. I would also want to see what medications they're taking because that could also trigger asthma. The most common symptoms of asthma are cough, with or without mucus production, difficulty breathing, I would hear some wheezing when I would listen to the lungs, and some ways to prevent asthma is just to be knowledgeable about it, just so you can evaluate your impairment and risks for asthma. So some findings, it may be in your family history. Asthma is a hereditary disease, so any member of the family can have asthma. So some therapy for asthma could be corticosteroids. They're the most effective in alleviating the symptoms. They improve airway function and decrease peak flow variability. Immunomodulators. And I would also let them know about peak flow monitoring. Peak flow monitoring measures the highest airflow during a forced exhale. So then I would explain to them how to use a peak flow meter. So measuring your peak flow can tell you and your healthcare provider how well you blow air out of your lungs. If your airways are narrowed and blocked due to asthma, your peak values will drop. So then I would say that you could check your peak flow at home. Here are some basic steps. Move the marker to the bottom of the numbered scale. You're going to want to stand up straight. Take a deep breath in. Fill your lungs all the way up. Hold your breath while you place the mouthpiece in between your teeth. Close your lips around it and do not put your tongue against or inside the hole. You would then blow out as hard as you can in a single blow. Your first burst of air is the most important when doing this, so blowing for a longer time will not affect your result. And then I would write down the number that I get. But if you cough or you didn't do the steps right or you didn't write the number down, I would advise that you do it again. Then I would move the marker back down to the bottom and repeat all the steps 2 more times. And the highest number that you get, I would write it down and I would log it in your chart. And sometimes people can even carry asthma diaries where they write down their symptoms so they can keep track of if they have worsened, if they're having positive progression with their diagnosis. And then another one is inhalers. So you would give the inhaler a shake, press down the inhaler quickly to release the medicine. As you start to breathe in slowly, I would breathe in for 3 to 5 seconds and hold your breath for 10 to allow the medicine to deeply go into your lungs. So that is just a little bit about asthma. And I would ask them if they had any questions, concerns. With asthma, it's always important to get ahead of the game to prevent that severe asthma attack. And I would strongly emphasize that as well with them. Thanks.